Hi all. So today we'll be discussing about joints. This is a very important point for your exam. We shall start with the definition. A joint is a meeting point or a junction in between two or more bones or between a bone and a cartilage. It is also called articulation or arthrosis. Joints have mainly two functions. They give the skeleton mobility and they also hold the skeleton together. So here I'll walk you through different classifications of joints and also highlight the exam relevant points to remember. We can approach joints in different ways for study and for examination. The first classification is by structure. The second classification is by function. The third classification by region. And fourthly, by how many bones take part in the formation or in the articulation of the joint. So in the structural classification, the sub-classifications include fibrous joint, cartilaginous joint and also synovial joint. So as per structural classification, there are mainly three sub-classifications for it. There is fibrous joint, cartilaginous joint and synovial joint. Again, the fibrous joints are divided into three: the sutures, syndesmosis and gomphosis. So fibrous joints are divided into sutures, syndesmosis and gomphosis. Now coming to cartilaginous joint, there are two sub-classifications for it. The first one is a primary cartilaginous joint. They are also called synchondrosis. The second one is a secondary cartilaginous joints. The secondary cartilaginous joints are also called symphysis or amphiarthrosis. Now the third subcategory of structural classification was a synovial joint. There are a variety of synovial joints. Some of them are ball and socket or spheroidal joint, cellar or saddle joint, condylar or bicondylar joint, ellipsoid joint, hinge joint, pivot or trochoid joint, and plane joints. Now the second one is the functional classification. Functional classification is according to the degree of mobility of the joint. So here there are immovable joint, slightly movable joint and movable joint. So immovable joints are mainly the skull type of joint. Slightly movable joints are vertebral type of joint and freely movable type are limb type of joints. So this again you can write a separate point in examination as a separate classification. You can say there's a regional classification where there are skull type of joints, vertebral type of joints and limb type of joints. And you can mention that skull type are immovable, the vertebral type is slightly movable and limb type is freely movable. Now if an examiner asks for a quick pattern, state that these are they reflect functional needs, like skull reflects protection, vertebral joints reflect flexibility with stability, and limb type reflects wide range of motion. Now the fourth type of classification is a classification by number of articulating bones or the number of bones that participate in the formation of that joint. So here the subclassifications include simple joint, compound joint and complex joint. So here we are thinking about how many bones form the joint. In simple joint, only two bones articulate. So an example is interphalangeal joint, that is in between your fingers. You have the interphalangeal joint. Only two bones articulate to form this joint. That is a simple joint example. Now second one is a compound joint. In compound joint, more than two bones articulate within one joint capsule. For example, in the elbow joint or the wrist joint. Here there are more than two bonds and they articulate within a single joint capsule. The third one is a complex joint. So in complex joint, the joint cavity itself is divided by an intra-articular disc. So there is an intra-articular disc and it is dividing the joint cavity. Example is temporomandibular joint. In temporomandibular joint, there are two divisions or there are two regions which are separated by an intra-articular disc. Also another example is sternoclavicular joint. So coming to the explanation of each of these joints, what we'll focus mainly is the structural classification. In any of the classifications, all of these joints would come somewhere or the other. So structural classification is the most important one for exam point of view. So we shall start with the fibrous joint. So starting with the fibrous joint, it is the simplest in terms of movement. Fibrous joints are held together by fibrous tissue. So that is the name. There are three types: sutures, syndesmosis and gomphosis. Now coming to sutures, the sutures are found between the bones of the skull.
So bones are joined by sutural ligament and there's essentially no movement. So remember that sutures are synarthrotic, they are immovable and they're unique to the skull. The next one is the syndesmosis. In these joints, the bones are connected by interosseous ligaments or membranes. Examples include the inferior tibiofibular joint and the middle radioulnar joint. So, in both of these examples, we can see that uh, there are two bones found in that region. Tibiofibular joint, there is tibia as well as fibula, and they join together by a membrane, interosseous membrane, which allows for their rotation, rotation along the axis which runs parallel to it. In case of radioulnar joint also, radius is present and ulna is present parallelly and they join together by the interosseous membrane. So syndesmosis allows only slight movement. So we can think that syndesmo means a band or ligament. So a band or ligament allows only a slight movement. So syndesmosis is slightly movable joint and they're connected by interosseous ligament or membrane. The third subclassification is in fibrous joint is the gomphosis. The gomphosis is also called a peg and socket joint. So peg and socket joint, a typical example is a tooth. So tooth is connected to the mandible as well as maxilla by a peg and socket joint, that is a gomphosis. So gomphosis are immovable. Your teeth never moves inside your mandible or maxilla where it is joined. So it is an immovable joint. Now a separate video including the easy method to draw the fibrous joints is done. It is linked in the I button on top right. It is a less than 3 minutes video. Please go through it. So you get an easy method to draw the diagrams for exam and it will help you fetch better marks. Next up, we have the cartilaginous joint. So second classification within the structural classification was the cartilaginous joint. They're united by cartilage and they're divided into two forms. There's primary cartilaginous joint and secondary cartilaginous joint. Primary cartilaginous joint or synchondrosis. They are joined by the hyaline cartilage. So hyaline cartilage is present in synchondrosis. Example is an epiphyseal plate between the epiphysis and diaphysis in a growing long bone. Then also the joint between the first rib and the sternum. There are also hyaline cartilage is present. So a synchondrosis joint is present in between the first rib and the sternum. So generally these joints are immobile. So the epiphyseal plate is a classic example. I can also mention growth plate if they ask. Now second subclassification of cartilaginous joint is a secondary cartilaginous joint, which is also called symphysis or amphiarthrosis. Now these are joined by fibrocartilage and they're permanent. So example include intervertebral disc between the vertebral body. Then we also have pubic symphysis where both the hip bones, they're joined at the pubic symphysis by fibrocartilage and this forms a secondary cartilaginous joint. Another example is the manubriosternal joint where the manubrium and the sternum is joined together. Secondary cartilaginous joint permits slight movement. So if a question asks for an example that allows slight movement, you can cite intervertebral disc because it is connected by secondary cartilaginous joint which is slightly mobile and they are joined together by fibrocartilage. So in answering an exam question comparing primary and secondary cartilaginous joint, you can list the differences as primary cartilaginous joint consists of hyaline cartilage while fibrocartilage is present in the secondary cartilaginous joint. Then primary cartilaginous joints are temporary in nature. As the bone grows, the epiphyseal plate would disappear, so it is temporary. But fibrocartilaginous, secondary cartilaginous joint, they are permanent. Then you can also mention about mobility. That is primary is immobile while secondary is slightly mobile. So separate video which mentions the easy method to draw cartilaginous joint is done. That is also a very short video. It is linked in the I button on top right. Please go through it to get an easy method to draw a diagram for exam. So it help you fetch more marks for your exam. Now we move on to the third classification within the structural classification, which is the synovial joint. It is the most evolved and the most stable joint. These are high yield questions for exam, so learn both their features as well as types. Synovial joints have 7 key characteristics. First of all, they have an articular surface covered by hyaline cartilage. So, articular surface covered by hyaline cartilage. Second important feature is synovial fluid, which is helpful in lubrication. Third one is a fibrous joint capsule or capsular ligament is present in the synovial joint. A fourth key characteristic of synovial joint is a synovial membrane, which produces the synovial fluid. Fifth, we have the ligaments, both primary as well as accessory ligaments, which helps to stabilize the joint. The sixth is the intracapsular or intra-articular structures such as tendons, articular disc, labrums, and fat pads. The seventh one is a free movement, the degree of which depends on the specific joint type. So when you list these features in answer, explain one short function for each. For example, when you mention synovial fluid, you can say that it helps to reduce friction. Or when you mention capsule, you can say that it provides stability while permitting movement. Synovial joints are classified by shape and movement. There are different classifications within the synovial joint. The first one is a ball and socket or spheroidal joint. Example, hip joint or shoulder joint. So these are multi-axial and they permit movement in several planes. So you can describe one movement for each plane. For example, you can say the shoulder joint and hip joint, which are multi-axial, ball and socket variety. They have flexion, extension, abduction, adduction, rotation. The second subclassification within synovial joint is a stellar joint or the saddle joint. Example you can mention is carpo-metacarpal joint of the thumb. So they are biaxial joint. You can remember that saddle joint gives the thumb its opposable movement. Thumb is the only finger which has got the opposability. So that is a good point to include in the exam. Thirdly, we have the condylar or bicondylar joint. For example, the knee joint is often described as bicondylar. So movement is primarily in one plane with some rotation. So if they ask for clinical relevance, you can mention some common injuries like ACL tear that affects the stability of this kind of joint. Fourthly, we have the ellipsoid variety of joint. The example you can mention is wrist joint, that is radiocarpal joint, which is a joint between the radius and the carpal bones. They are biaxial. They allow flexion extension movement, also abduction adduction movement. Then we have the hinge joint. Example is elbow and interphalangeal joint. So in the elbow as well as in the interphalangeal joint, there is uniaxial movement. So they permit flexion and extension. You can remember that hinge, like in a door, there is a hinge. So in door also the action is flexion and extension. You can remember hinge joint like that. Examples are elbow and interphalangeal joint. Next up we have the pivot or trochoid joint. For example, in the atlantoaxial joint, that is in the neck between the atlas and the axis, which is the first and second vertebrae, we have the pivot or the trochoid joint. Also in the proximal radio-ulnar joint, we have a pivot joint, which allows for the rotation around an axis. The clinical note is that atlantoaxial rotation is vital for head turning, and here any damage will affect the rotation of the neck. Next up, in the synovial joint, we have the plane joint. In plane joint, both of the articulating surfaces are plane. Example, intercarpal joint. So they allow gliding or sliding movement. So for short answer, you can pair plane joints with examples in the wrist or foot. In this video, I have explained just briefly about the synovial joint only. I shall do a detailed video dedicated to synovial joints only, since it is an important exam topic. You may go through that video to prepare for a long question on characteristics and classification of synovial joints. Here in this video, we have covered the points necessary to write for a long answer on joints generally and its classification. Like generally, if they ask for joints and classification, you can write whatever we have discussed in this video. I hope it was helpful. Thank you.